Hi, welcome to the Patient's Guide to Methylphenidate. These videos should be used to answer some questions you might have about methylphenidate. If you have other questions about methylphenidate, you can access the other parts of the guide, the paper patient information leaflet, and if you have any specific questions about your own care, you should ask your own healthcare provider. There are 5 parts to the guide. Part 1, the basics of methylphenidate. Part 2, your health in methylphenidate. Part 3, your life in methylphenidate. Part 4, side effects in methylphenidate. Part 5, dose changes in methylphenidate. Part 1, the basics of methylphenidate. What is methylphenidate? Methylphenidate is a stimulant medication that's sold under brand names such as Ritalin, Concerta and Delmasart. There are 2 main types of methylphenidate. There's short-acting and long-acting. Short-acting methylphenidate starts working quickly within about half an hour and wears off in about 3 to 6 hours. Long-acting methylphenidate contains a short-acting part, which works immediately, and also a slower release part, which starts to work several hours later. This wears off in about 8 to 16 hours. What is methylphenidate used for? Methylphenidate is most commonly used in patients with ADHD or attention deficit hyperactivity disorder. You might also take it if you have narcolepsy, and it's sometimes used to treat fatigue and mood problems. How do I take methylphenidate? This will depend on what your doctor has decided, but most often you'll take methylphenidate as a yellow, white or grey tablet between 1 to 3 times every single day. This might change as your doctor tries to find the right dose for you. Part 2. Your health and methylphenidate. When shouldn't I take methylphenidate? You shouldn't take methylphenidate if you are allergic to any of the ingredients. A full list of ingredients can be found in the paper patient information leaflet. If you have a heart problem, such as a structural problem, heart failure, high blood pressure, or if you've ever had a heart attack. You have a severe mental health condition such as severe depression, schizophrenia, mania, or anorexia. Or if you're taking a medication called monoamine oxidase inhibitors, such as phenelzine or selegiline. What conditions should I let my doctor know about before taking methylphenidate? You should let your doctor know if you have any of the following conditions: a structural heart disease, anorexia, increased pressure in the eye, also known as glaucoma, high blood pressure, even if it's treated, Tourette syndrome or any other tic disorders, a problem with your thyroid gland, or a problem with your adrenal glands. Which medication should I let my doctor know about before taking methylphenidate? You should let your doctor know if you take any of the following: warfarin, phenytoin, a tricyclic antidepressant such as amitriptyline or nortriptyline, a selective serotonin reuptake inhibitor or SSRI such as citalopram or fluoxetine, or a monoamine oxidase inhibitor or MAOI such as phenelzine or selegiline. These medications might interact with each other and mean they don't work as well as they normally do. Part 3. Your life and methylphenidate. This part will be most relevant for teenagers and adults, so feel free to skip if that doesn't apply to you. Can I take methylphenidate and drink alcohol? You shouldn't drink alcohol if you're taking methylphenidate, as it may make side effects worse. Remember that some foods also contain alcohol, so make sure to avoid these as well. Can I take methylphenidate if I'm pregnant? If you're pregnant or planning to have a baby, you should talk to your doctor before taking methylphenidate. You can take methylphenidate whilst pregnant, but the full risks of taking the medication during pregnancy are not yet known. There is a small risk of heart conditions in babies if it's taken during early pregnancy, so it needs to be a conversation between you and your healthcare provider. Can I take methylphenidate if I'm breastfeeding? If you're breastfeeding, you should check with your doctor before taking this medicine, because it can pass into breast milk. The risk of this is not yet known, so it's a good idea to have a chat with your healthcare provider first, so you can make the best choice for you. Can I take methylphenidate and drive? When it comes to driving and operating heavy machinery, methylphenidate might make you dizzy or give you blurred vision, so you shouldn't drive, use any tools or machines, or perform any dangerous activities until you know how methylphenidate affects you, so it's best to wait to start with. Part 4. Side effects of methylphenidate. What are the important side effects of methylphenidate? If you get any of the following side effects, you should tell your doctor immediately or seek urgent medical attention. Signs of an allergic reaction. This will include sudden difficulty breathing or hearing a wheezing sound, sudden swelling of the eyelids, lips, face, tongue or hands, or a sudden rash or itching, having a sudden mood or personality change, or even seeing or hearing something that isn't there. And lastly, losing control of your muscles, feeling particularly weak, or having a fit or a seizure. What are the common side effects of methylphenidate? Very common side effects are those that affect up to 1 in 10 people. So if you had 10 people in a room, typically only one person would experience it. These very common side effects include headaches, nervousness, and difficulty sleeping. Common side effects are those that affect 1 in up to 100 people. These include blurry vision, joint pain, a dry mouth or feeling extra thirsty, a fever, reduced growth, a high blood pressure, and dizziness. A full list of side effects can be found in the paper patient information leaflet that comes with your specific medication. Part 5. Dose changes and methylphenidate. What do I do if I take more methylphenidate than I should? If you've taken more medication than you should speak to a doctor or seek urgent medical attention. Remember to tell them what you took and how many tablets. If you've taken too much methylphenidate, you may feel some of the following. You might feel sick or nauseous, have unusual movements or fits. You might have a fever or a high temperature. You may be able to feel your heart beating in your chest. You may have very big pupils. These are also signs that you should seek medical attention. What do I do if I miss a dose of methylphenidate? If you've missed your normal dose of methylphenidate and are unsure of what to do, the most important thing is to not double up. Just take your normal dose at the next time that you're due for one. What do I do if I want to stop taking methylphenidate? Don't stop methylphenidate or any medications without consulting your doctor first. And stopping methylphenidate abruptly or immediately can result in withdrawal symptoms. Your doctor can advise on how you can slowly reduce your dose until you're no longer taking methylphenidate if that's what you choose to do. Thanks for watching The Patient's Guide to Methylphenidate. Hopefully this has answered some of the questions you might have had about methylphenidate. Feel free to access the guide again if you feel that you need to brush up on anything that we've covered. You can also read the paper patient information leaflet that came with your medication. And remember, if you have any specific questions about your own care, you can speak to your own healthcare provider. Thanks for watching.